Now we're getting to the real thing about therapy now. We're going over the preliminary. Now we go through real fast. So the first phase is really the first thing. Of course, you present your presence. Now that presence better be real you, whether professional or real. It cannot be a phony one, right? Now, do you think I'm crazy? No. You first see me, you see I'm a crazy old man? I'm 73. What am I not old enough? Yeah, I'm 73, and I'm an old man, right?
Okay, if that makes you happy, yeah.
But when I go for interview, when I go to interview for a job, have you tried for interview for a job? An experienced recruiter starts you up in 3 or 4 seconds. Now, you might try to put your best foot forward. You might do the best makeup in the mirror, put on a dress code, and you try to practice walking, It doesn't matter what you do. 3 seconds, they see through you. There's something about what's inside you will come out one way or another. Nobody to catch you. After the formal interview, let's go have a drink. That's where you let your hair down, right? For yourself. And then you see more your real color more clearly. So really to be a good therapist, it has to do with start with you. What kind of person you are. Now, Jeff is a gentle person, and he's a very kind, fatherly figure. And it comes through, right? I don't know how you think about the guy in treatment movie. In treatment, what do you think about that psychotherapist? He looks so depressed to me. I don't know. The movie.
Pensive is attractive, though.
Huh?
That sort of pensive. He's pensive.
Pensive, yeah. He looks pensive and look worried, carry burden. Doesn't have this positive energy, doesn't have this positive energy. There's a moment I still have my energy, right? I still have my energy. He doesn't have this energy to lift you up. Always. So what you are, is a big factor. In fact, your presence is the biggest factor in the therapeutic equation. It's the biggest one, okay? So you really look in the mirror and say, well, what kind of guy am I? How do other people see me, right? And the therapeutic environment is partly reflect who you are, right? If the environment is very structured, very clean, that's you maybe. If a room is very casual, but that also reflects you. Now, her clinical office is so tidy, but she's neat and it's all messy, right? So my office will be different. That's me, right? So your environment. That doesn't matter whether messy or clean. It has to make people feel welcome, feel safe, right? They have to feel welcome, feel safe. Yeah. Now you're explaining what the means therapy is all about, right? We talk about characteristics. See, one of the things to tell people say, I'm not going to give you a fish. I'll teach you how to fish, right? You give them the tools they need to cope with life. Give them the tools they need to know themselves. I can give you all kinds of objective tests. That doesn't require real you. You have to know who you are. You know yourself because your self-knowledge ultimately determines everything you do. All the scores, you score this, you score that. Oh, I'm introverted, score high. I'm high on this, low on that. All the scores do not make up you. You have to discover who you are. So you have to learn how to discover yourself. So the part of explaining what it's all about, okay, and also explaining the importance of relationship. Sometimes I ask my client, I say, do you like me? Do you love me? If a Chinese client would say, I said, honestly, do you like me? Yeah. Do you love me? Not in a romantic sense, okay? To love me as a human being, right? To care about feelings. If you care about feelings, you will get mad. Don't throw a cup at me. Don't throw something at me. I'm a human being, right? So there's some genuine dialogue going on, okay? So about relational. And also learn to listen proactively. There's lots involved in listening, okay? And like Jeff demonstrated listening a bit differently from Dr. Moran, okay? So sometimes listening requires silence, right? So it's okay not to say anything, just look at you. Eyeball to eyeball. Oh, I don't embarrass. Better behave myself. Better behave myself. so the listening is the key. There's lots involved. There's different level of listening. Okay, you can ask Jeff how to do that. Okay, different level of listening. Next slide. Come on, hurry. We'll talk about that already. The concept practice constant by osmosis. Now, if me remember, the one of the lecture at Trinity, I talk about that, right? Because often constant takes place, it's like a transfer of energy from one person to another person. No, it's not just verbal. You can either lift people up or bring people down. It's something about you. It generates some positive energy or negative energy. Now I'm getting into this energy therapy now. There's no, okay? I'm not talking about that, okay? There's something about you that affects other people. Negative, positive is all contagious, okay? Happiness contagious. Depression is also contagious, right? Okay, next slide. I have to go through pretty fast, okay? Now, here relationship. This is, I cannot emphasize more, okay? Now, do you all know Rogers' three conditions for therapy? What are three conditions? Come on, give it to me. Come on, louder. Okay, thank you. Three things, right? Empathy, unconditional positive regard, and genuineness. Now, Roger has a lot of experiments, studies show that if you have, these are the three necessary and sufficient conditions for effective counseling therapy. Now, if you have these three conditions, you demonstrate empathy, demonstrate positive regard, demonstrate a genuineness, not phony, okay? Really funny. Then there's healing power. Now, Buber go further than that. Buber, okay? Buber is a German philosopher. Is that how to pronounce Buber? Buber or Buber? Buber, right? Buber, okay. Martin Buber. He's a very influential German, Jewish German philosopher. Now, what's the difference between Buber and Carl Roger? When Carl Roger talks about positive regard, empathy, or genuineness, he talks about the quality about the therapist, right? The quality of therapy. If the therapist possesses those qualities, he will be very effective. But Buber talked about something more, and Buber's idea was developed by Freeman. It's also another humanist psychologist, Freeman. I think he also teaches at Saybrook University. Freeman talked about dialogical psychotherapy. So Buber talked about I-thou relationship. What provides healing is not just the quality of the therapy, but about the relationship, I-thou relationship. There's something between the two people. The relationship is something like organic, something real. It's a thing, okay? It's a thing, okay? So we'll say, I understand you. I put myself in your shoes. but that might not be a relationship. But here, I thought relationship is different because why do I show empathy? Why do I show positive regard? Why do you show genuineness? I possess this quality because I am inviting you to enter into a relationship with me as a unique person, and also as a person who will learn from me to possess the same qualities. Okay? So I can be empathetic, I can be accepting, I can be genuine, but that's me. I want you. I want you. Yeah, you. The one in blue shirt. I want you. I want to have a relationship with you so that the relationship will provide healing to your problem. I don't provide healing, the relationship. They call therapy by meeting. Therapy by meeting, by existential encounter, by the meeting of two people. That's one. You know why it's important? Because when I talk about relationship, I say, I'll be focused on not just empathy, positive regard. I also open on openness. That's how be openness. Like the I-thou relationship. When you stand before God, God see you as naked. You can play game, right? I mean, when you stand before God, you have to come before God with openness, with honesty, with humility. Similarly, when we talk to people, there has to be a sense of openness. And that's my wife is more careful than I am. She said, "Oh, you can't trust everyone." Okay, I mean, otherwise be vulnerable. But in a critical situation, the therapist has to be willing to be vulnerable. About how go to business world, you have to be careful, right? You can't trust everyone. But in a critical situation, you have to be willing to be vulnerable through self-disclosure, and through sharing, your expressing your feelings. So there has to be some openness and mutuality.